Hello everyone, welcome to Feminine. I am Dr. Neha Gupta and I am going to talk in this video about a very common confusion. So there is a lot of overlap in the symptoms of early pregnancy and PMS. And many times women are confused whether I am pregnant or whether this is just PMS that I am having. So I will elaborate a little bit about this. First of all, what is PMS? PMS means the premenstrual syndrome. It is a set of physical and emotional symptoms which happens about 2 weeks before your periods. And once you get the periods, the symptoms subside. And then there is a symptom-free interval of about 2 weeks. And then from the mid-cycle, again the symptoms start building up. And again, once you get the next period, they will go down. So this keeps on happening in a cyclical fashion. The symptoms build up about 2 weeks before the periods and then they subside after the period, again to build up 2 weeks before the next period. Now, what are the physical symptoms of PMS? The physical and the emotional symptoms there can be bloating, there can be headache, there can be breast heaviness, mild pain, tenderness in the breast, there can be lot of tiredness and fatigue. There can be food cravings of different types of foods, and then there can be emotional symptoms like anxiety, crying spells. So those are usually the common symptoms that one would see in PMS. And again, these are also the symptoms that can occur in early pregnancy. In early pregnancy also, there can be breast tenderness, there can be bloating, there can be headache. In both the conditions, there can be cramps in the lower part of the tummy. In both the conditions, there can be feeling of nausea, there can be vomiting, and again in early pregnancy one can feel very tired and very fatigued out, feeling like sleeping all the time. So then how do you know what is happening? The normal period bleeding will not happen if you are pregnant. That is the most important thing. If you are experiencing these symptoms and your period just does not come, then you have to do a pregnancy test, because doing a pregnancy test is the only way to know definitively that yes, I am pregnant. If you do a whole pregnancy test and you see 2 lines, then you know that you are pregnant. So one difference is that if you are pregnant, the periods are not going to come. However, one should know that even in pregnancy, in early pregnancy, there can be slight bleeding, which is the implantation bleed. When the fertilized egg gets implanted in the womb, in the uterus, there can be some bleeding, and this bleeding usually coincides with the time when the period was expected to come. So you may think that you are having a period, but it is actually an implantation bleed and it is actually a pregnancy that has happened to you. So the implantation bleed is usually very less or scanty as compared to your normal period. So if you are having all these symptoms and either the period does not come at all, or the period comes, a period like bleeding happens, but the bleeding is not like your usual period, the amount is very scanty or less, then you should suspect that there could be a pregnancy and you should do a pregnancy test, because pregnancy test is the only surest way to know whether you have a pregnancy or you don't have a pregnancy. And then again, if it is a PMS, then after a build-up of the symptoms, there is going to be a proper period. With the periods, your symptoms are going to come down, and then there will be a interval of say 12-14 days when there will be no symptoms at all. You will feel absolutely fine, and so these symptoms will keep on happening in a cyclical fashion. Whereas if you are pregnant, then the period will not come, or a very light bleeding or spotting may happen, and the symptoms are not going to come down. The nausea may just persist, the headache may just persist. You may continue to have cramps in the lower part of your tummy. You may continue to feel very tired. So that is the difference between pregnancy and PMS. The symptoms are overlapping. What I would say is that you know your body the best. If you feel anything which is not in the usual pattern, then it is always best to do a pregnancy test and be very sure that there is no pregnancy. And if there's any doubt, then it is best to consult a gynecologist who could help you out with resolving the doubt and also manage your PMS if it is just a PMS. So I hope you found this description helpful, and it has given you some idea on when to do a pregnancy test, when to suspect a pregnancy, and what basically is PMS. If you have any further doubts, please do let me know. Stay safe, stay healthy. Bye bye.